Good evening, everyone, or good afternoon, everyone, and thank you for joining us for our first virtual town hall meeting in partnership with the Alameda County Public Health Department about educating students in Alameda County in the time of COVID-19. My name is Aisha Knowles. I'm a trustee for Area 4 on the Alameda County Board of Education, currently serving as the board president. And on behalf of our board, we'd like to welcome you to this town hall meeting. Today's meeting will feature Alameda County Superintendent Karen Monroe, as well as Dr. Louis Gerling from the California Children's Services Organization. He is the medical director, and Lisa Erickson, the Family Partnership and Elementary School Coordinator for the Alameda County Public Health Department. We will be recording this meeting, and throughout the meeting, though we will take questions later in the meeting after we finish hearing from presenters, you are able to post questions in the chat. And for those of you who are not able to watch on Zoom, this meeting will also be live streamed on Facebook. So again, on behalf of the Board of Education for Alameda County, welcome, good evening. And I will say good evening to Superintendent Monroe and ask that she help get the meeting started.
We're wanting to continue, and I want to make sure we're making the best use of our time as the team seeks to make sure that we can have a seamless experience from here, and we'll have to take questions in the chat for now until we can figure out how to be more public. At any rate, a little bit about the Alameda County Office of Education. Here's our vision and mission. A little bit about what we do. I'm going to work our way through these slides quickly so that we can get to more of the information from public health. This is our board. You can see President Knowles in the middle. We have a 7-member board. They are elected by areas. And here you can see their term dates. And we have several long-standing members. So welcome to the board members who joined us this evening. Next, please. This is a little bit about the role of the county superintendent. So what I do in the county, my responsibility is to serve as chief administrator. I represent our county at the state level on education issues. I oversee the districts fiscally, and we also look at our districts and improve. I approve instructional plans as well. We support and provide guidance and do a lot of professional development and convening of different educational stakeholders. Next, please. So here, this is something that, that began to form in March and is a way of working that we really are adhering to fairly closely on a weekly basis, if not more often. So you have the Alameda County Office of Education, which provides the supports that I went through largely. Our board is the appellate board. Our board approves or denies charters as well as interdistrict transfers. But at the Alameda County Office of Education, we run the school programs for our youth and for juvenile hall. Again, supporting the districts, supporting with facilities, and really with the guidelines that are put out by the Alameda County Public Health Department, helping our education stakeholders to really understand what those guidelines mean for schools. And we work directly with public health on the liaison training and really being a support and an intermediary there. When you're looking at public health really, as you know, the public health officer has the ability to write public health orders and determine the timing for reopening. So as this works with the state sets particular guidelines, and counties, while they cannot be less restrictive, can be more restricted based on a county's particular data. So the public health officer has the ability to implement both strategies and timelines and precautions that are seen to be needed in a particular county. And what our school districts do is take all of those plans, our guidance and support, the public health orders, and makes their own plans for implementing and works with their communities and their stakeholders to determine the best plans for reopening. So each district is responsible for considering the implementation of safety measures in their own district, and for our schools as well. We have a number of charter schools and private and independent schools in the county. Next slide, please. So here, as you all no doubt know by now, we are in the red. So we moved from purple into the red, and the public health department has determined that we can begin reopening schools. And as of tomorrow, there is the ability to reopen elementary schools for those who have put the necessary measures in place to do so. This is a process, I should say, that absolutely takes time right now for those who have submitted their intent to reopen. We have the vast majority of them are private and independent schools. And our district schools have vastly more stakeholders and more sites to consider as they look at implementing all the necessary measures before opening. Next slide, please. So when you look, and some of this I said, when you look at what it takes to reopen, we're looking at, there are provisions for the size of a cohort, the size of groups that are available, how many teachers or adults can be present in those groups and in how many groups. Physical distancing, as we all know, continues to be vitally important. Face coverings also important and required. Health screenings are recommended. Immunizations continue to be required. Reducing risk by doing more testing and contact tracing. And then limiting campus activities. So students and staff are limited as to the number of different groups that they will be allowed to participate in. Next slide, please. So here I'm going to turn this over to our Director of Public Affairs and Communications, Michelle Smith-McDonald, who will walk us briefly through the guidance.
Hi, good evening, everybody, and thank you for your patience tonight. I wanted to just show you that we have prepared a substantial guidance document that is located on our website at the URL located at the bottom of the screen, acoe.org/guidance, that encompasses many of the state and county guidance. It encompasses some CDC guidance. It covers all manners of subject from facial coverings to cohort size. There are significant FAQ sections in there, as well as addendums that address specific issues as to how our schools are going to be working with their protocols and working on the things that they need to do in order to bring students and staff back safely. And so that is, while a bit of a long document, certainly an informational read, and it is updated regularly. We are on version 10, and we are updating it virtually every week with new information, and should have some updates this week as well. In addition, I just wanted to share that we have been hosting regular Zoom meetings since March to provide updates and take questions from our public, private, and charter schools. We have held additional meetings with our Alameda County School Board trustees and labor partners. And this guidance document is easy to find and iterative, so please use it as a resource. Thank you very much.
Thank you so much, Michelle. So we're, just to say a little bit more about that document, we are always referring folks to it. Yes, it's definitely a lot of information, but the team has done a great job at making it as accessible as possible. And it's very rare that a question that someone might have in a school or even from the community is not taken into account in that document. So we would encourage you to take a look at it and familiarize yourself with it if you have specific questions. So looking at the guidance and the support, we're talking here about how ACOE supports the districts in planning and in distance learning and reopening. We've been working with districts since March to really help support in that planning process. As you well know and can imagine and appreciate and perhaps are becoming frustrated with in some ways, that this process is a fast changing one. So the plans that were put in place some time ago have changed dramatically. As you can remember, in March, a lot of us, myself included, none of us saw this lasting as long as it has. And now what we're aware of is that we don't know how much longer exactly will be in, exactly what our plans will require to reopen in this new reality. So we're continuing to work with our districts to put that into place. So, so we have with our new with our waiver applications and now our reopening plans, the first line is ACOE. So we are taking in those applications. We were doing that with waivers. Now that we're out of the purple and in the red, the waivers are no longer required. Districts can submit their applications, and what we're doing is reviewing for completeness. We're looking to see that within a checklist format, that the things that need to be addressed have been addressed, and then those get posted and sent on to public health to be posted on their website. Needs to be posted on your website if you're a school or a district, and we'll post it on ours as well as ACOE. Next slide, please. So COVID liaison training. I'm wondering if, Michelle, you want to talk a little bit about that, either you or Lisa. You can see that we have trained to date 275 people.
Yeah, I'm going to hop in on this. So COVID liaison training is part of the process that our schools need to be able to reopen safely. And so schools and districts are designating COVID liaisons who will work as the touch point with public health and also with their own districts and school sites to help train other employees to make sure that they know the guidance document backwards and forwards, that they understand the protocols for working with public health. And so Public Health and Alameda County Office of Ed joined forces last week to hold a pair of 4-hour training sessions in which we trained more than 275 school employees to serve as COVID liaisons. And that was, this is part of preparing our schools to get ready for eventual reopening whenever that is. Next slide.
Great. So the other thing we've been working really hard on, and I've been working with a number of folks to really look deeply into what it would take to implement a testing protocol. And one of the things I've been committed to is ensuring that whatever we discover research can be used not only countywide, but is available statewide. This, as you may know, is an issue for most districts, looking at how we screen our employees for what's called surveillance testing. So it's not necessarily symptomatic testing that you would go to your doctor to receive, but surveillance testing, which is just on a regular basis, at regular intervals, looking at testing to ensure that that is implemented. It's recommended by the state, and it's one thing we would like to have in place. So this week, I was able to sign a contract with a company who will be providing surveillance testing to our staff throughout Alameda County and also in other counties throughout the state. We're really optimistic that this will work well. It's a simple protocol, and we'll be putting out more information about it as districts begin to look at what it's going to take to reopen and how best to implement that. Next slide, please. So looking at next steps, and this basically sums up most of what we've talked about. So looking at your local reopening plans, in one way or another, our districts have considered what their plans are for reopening. Looking at testing and screening, while not mandated, certainly it's prudent practice to make sure you're doing testing and screening, having COVID liaisons who are really the first touch point at schools, and working closely with public health. Should there be a case at a school, to make sure that we know that early on, and are in contact with public health as we move forward. And then our labor partners at schools, making sure that both our certificated and our classified staff are up to date, know the protocols, have received, where necessary, the proper accommodations, and understand what they need at their sites and in their classrooms in order to come back to school. Next slide, please. So I'm going to turn this particular slide over to Dr. Lewis Gerling, who's going to go over some of this data with you.
Dr. Gerling, I've got you. Hold on one second. Okay. Dr. Gerling, are you able to?
Thank you. Yes, I couldn't unmute myself, but now I can. Thank you for rescuing me, Michelle. Thank you everyone for giving me the chance to provide you a little bit of information about our Alameda County public health data with respect to COVID-19. This is a very busy slide, but it is a picture of one page of the Alameda County COVID-19 dashboard, which you can find on the Alameda County's Public Health Department's COVID-19 website. And just to orient you to it, to give you a sense of the kind of data that you can see, in the upper left-hand corner, that 22,149 cases, that's the total number of cases of COVID-19 that have been documented in Alameda County, and 436 deaths have been observed in Alameda County due to COVID-19. Down on the lower left, you see those two blue bars that look about the same length. That's males versus females. So this basically shows you that boys and girls, men and women, are affected pretty much equally. Just to the right of that, again down at the bottom, you see the total county cases by age group, and you see that big long bar, the second bar from the top, that's the 18 to 30-year-old age group. That's an age group that seems to be driving the pandemic in many places. And then a little further over to the right, total number of cases by race and ethnicity. And the large bar there is our Latino community, which have really borne the brunt, together with African Americans, Native Americans, and Pacific Islanders. They've really borne the brunt of this pandemic. At the top, that's the total daily cases, and you can see there's a big peak beginning in July up into mid-August, and then it starts to come down in October. So that's the total daily cases, and this is updated every day, so you can go to the website and see this. And finally, on the far right, you can see cases by different local jurisdictions, so cases by city. So we can go to the next slide. I was asked to speak just a little bit about cases in children. And you can see, if you skip down to the Alameda County numbers, these are just total numbers of cases. There have been 22,216 total cases in Alameda County, and about almost 2,500 of those are under the age of 18. So it's roughly 10% that are in the pediatric age group if you count pediatrics is 0 to 18. What I will tell you is that although we've seen cases in Alameda County in every age group, by far the rates are much higher in adults over the age of 19 than they are in children and teenagers. And the lowest rate is seen in the 5 to 11-year-old age group. So that's the elementary school age. That's where the lowest rates are actually seen. But all across all ages, there was a big peak in July and August, and the numbers are coming down in all age groups in Alameda County. So I think we can move on to the next slide, which I believe is Lisa's.
And Lisa, I've got you. I apologize. I've muted everyone and taken away their ability to unmute themselves just to keep us a little more.
I think I'm good now. Hopefully you can hear me. So I'm going to present briefly just on the health. First, I want to say hi, everyone. Welcome. And I'm just going to briefly present on the health equity metric. This was introduced by the state on September 30th. And it requires counties to ensure that the testing positivity rates in their most disadvantaged neighborhoods. And the way they define this is the lowest quartile of the US Census Healthy Places Index for California, or that's called an HPI. So it's called the Healthy Places Index. And that the positivity rates in those neighborhoods need to be in the same range as the county's overall test positivity rate. And to progress into the orange tier, you'll see this column here where it says tier 3 in the orange right here. In order to for us to progress into that next column, we would need to have a daily case rate between 1 and 3.9. And we need to have an overall test positivity rate of between 2% and 4.9%. And then the lowest HPI test positivity rate would be 5.2%, so below 5.2%. So let's see. And again, this health equity metric will not be used to move counties to a more restrictive tier. And right now, our lowest HPI has a testing positivity rate of 3.8. And you can see that down on the right-hand corner. Okay, next slide. So as you can see, there's still a lot of equity issues around COVID. The Alameda County Public Health Department continues to focus mostly on our most high impacted zip codes, which is West Oakland, East Oakland, Fruitvale, San Leandro, Ashland, Cherryland, and South Hayward. And you can see in this map, the darker areas here are those zip codes with the highest cases per 100,000, so the highest case rates. You can also see in the chart up in the right-hand corner, this is also the case rates for race ethnicity, and Hispanic Latinos have the highest case rate, and African Americans are also high. Pacific Islanders and Native Americans have the highest case rates in the county. And next slide. And this is back to Dr. Gurley.
And there we go.
Thank you, Michelle, and thank you, Lisa. So this graph essentially shows the number of new cases per day peaking in July and August, and then decreasing towards October. So the far left side of the graph is May, the far right side of the graph is October, and you can see that big mountainous peak in the center. But this is actually measuring something different than we showed you in the other slides. This is actually measuring hospitalization rates. So or actually numbers of people hospitalized, to correct myself. So you can see that that blue line, which runs along the top, represents the number of people hospitalized in Alameda County for COVID-19 reasons. And the orange line further down represents the number of people hospitalized in the intensive care unit. And this is really important information to see both of those lines trailing off to the far right, because this is actually an even better measure than the total case rates in the county of how well we're doing. When an epidemic, when this epidemic is really out of control, the number of severe cases increases and people end up in the hospital. When it's better controlled, the number of cases in the hospital decreases and the number of people in the ICU decrease. So this is actually a measure that public health officials watch even more closely than the other numbers that we presented previously. Okay, so we can go to the next slide. Okay, so this slide illustrates what's been going on with testing in Alameda County. We had as a goal at the beginning of our response to test at least 3,100 people per day, and we have surpassed that goal, and we continue to surpass that goal currently. The dotted lines, the horizontal dotted lines, the red one is 8%, that's the red tier. The one is 2% for the yellow tier. This is the percent positivity rate. In other words, of all of the people that you tested, what percentage of those people tested positive for COVID-19? And you can see we're currently down around 2%. Now, this is a very important measure because it actually reflects how well you're doing with testing the population appropriately. If your test positivity rate is low, that indicates that you're testing broadly a lot of people that are infected, but many more who are not infected, and you're broadly testing the population, which is a very important measure of how prepared you are to identify cases, isolate them, and trace their contacts. If the test positivity rate is very high, that suggests that you're only testing people who are sick and who are most severely affected, and that your testing program is not robust enough. So the fact that our test positivity rate is so low is an indication that we're doing a really good job in testing people across the county now in October. Okay. Time for questions.
Yeah, we're going to move into questions now. And so we are going to run this a little bit. We've been capturing the questions that have been in the chat. And so I'm going to start moving through them. And then we're going to have a couple of our staff members who are going to be recording responses and things so that we can turn around and be able to have some information out to the community, perhaps in the form of an FAQ from this, or we can add to our FAQ in the guidance document. But I'm going to start at the top. And so I'm going to start with, so these are going to be a little out of order based on the chat, but we've got these in a document. So can we get daily cases by zip code? This is a question for AC PhD. Oh, Dr. Gerling, gotta let you back in. Sorry.
Yeah, you might want to unmute Neetu as well, because she probably has more specific information about this. There are case rates listed on the website by city, and I believe by zip code as well. But I don't know whether they're updated daily, which is what the questioner is asking. And Neetu, do you know the answer to that question?
So the dashboard is updated daily, but it'll still be cumulative. So if you were to want to track day to day, what we are going to be making available soon is a large downloadable file that'll be available on the county's Open Data Hub website. That'll be available weekly, but you could essentially make those calculations if you were trying to track kind of points in time rather than a cumulative change in case rates. So the case rates are available by city. They're also available by zip code if you're looking at the dashboard. The map, the first map has the case rates by zip code.
All right. I have a question. Does the re-entry plan take into consideration the impact flu season will have on COVID increases, or the impact that flu will have on vulnerable people who may be prone to COVID? This is also a public health question. Oh, everybody. Sorry, everybody keeps unmuting. Dr. Gerling.
Okay, I think I'm finally unmuted. Well, this is a really important question that someone is asking. The flu season, as everybody knows, is right around the corner. And so maybe the most important response I'll give you is please get your flu vaccine, and please get all of your family members, including your children, their flu vaccines. It is certainly possible to be co-infected with both COVID-19 and influenza at the same time. That has been observed. And that's a situation that you may be able to avoid or at least mitigate by getting yourself vaccinated. One of our considerations in determining when we should reopen schools was we didn't want to open the schools in the middle of the flu season, because it would be very difficult at that time, if we had a lot of cases of respiratory illness, to figure out quickly whether we were looking at influenza or COVID in the schools. So we thought it was better if, now that our epidemiological data indicates that it would be safe for us to open the elementary schools, we felt it was better to do that well in advance of the flu season, so that we can observe to what extent reopening the schools might contribute to further spread of COVID-19. So we're hoping that, and I think we have very good reason to believe, that all of the mitigation efforts, those are all the things, the physical distancing, the face coverings, the hand sanitizing, and washing the hands and keeping the surfaces clean and so forth. All of those many efforts that Superintendent Monroe talked about that we're putting into place in the schools, we believe are going to reduce the possibility of transmission of COVID-19 in the schools considerably. And we're hoping that that's what we will observe in advance of the advent of influenza. So I don't know if Lisa or Nitu have something to add.
Lisa, you're unmuted, I believe. Nitu, I unmuted you as well, and Superintendent Monroe. So I think that as long as you don't mute yourself back, and I don't have to go back and mute you, we're good.
And me too. I just, maybe Lisa, if you're responding to this, if you could introduce who Nitu is, please.
Sure, I'll
Oh,
introduce myself.
yeah.
I don't think I have anything else to add, but I'm Nitu Balaram. I'm the Public Information Manager for County Public Health Department, and one of the responding public information officers to COVID-19.
Okay. Our next question is, has the county contracted for surveillance testing for all districts in the county, or just the County Office of Education? How often will testing be performed? And will there be rapid test results and testing available on campus for staff?
So I'll take that one. And what I'll let you know is in the next, before the end of the week, we will have details about this. This contract was just signed. The intent is that there will be testing across the county, not just the Alameda County Office of Education, but in the districts across the county. And it will occur at regular intervals. We have yet to determine what those regular intervals are. We know the state is recommending once every 2 months. We will likely be looking at intervals that are shorter than that, once every 2 months, but we're really ramping up. This is happening in real time. So I really wanted you to know that this is something we're focusing on, that this is something that we're serious about bringing to schools in Alameda County, and that there will be more to learn in the next couple of days.
Great, thank you. I know, Dr. Gerling, we're running up on your time. I just want to make sure that if we're asking one more question, perhaps before Lisa and Nitu can and take over that. Oh, we've got a little, all right. Let's do, Phil, or Ison, can you grab onto that comment? I'm sorry, I apologize. Now we've got all kinds of fun things happening in the chat. All right, let's go back to what does COVID screening and testing look like? Is it filling out a form stating that one doesn't have COVID symptoms?
Do you want to answer that, Lisa, or you want me to take it?
I can piggyback on you, Louis, if you want to just answer
Okay.
this. Since you're,
Okay, so the COVID screening that we've set up essentially means that every day, anyone reporting to the school before they come into the building is supposed to answer a number of questions about their symptoms, including whether they have fever, shortness of breath, cough, vomiting, diarrhea, body aches, etc. There's a long list of symptoms that they have to verify that they do not have those symptoms and that they have not had those symptoms since the last time they were at school or within the last 10 days, depending on the circumstances on the particular day that they're coming in. And then they also have to verify that they have not been in contact with someone who has COVID-19 within the prior 14 days. So that's the essential screening. People will have to, or will be expected to measure their temperatures before they come to school. We've had a little controversy about whether we think measuring the temperature when people arrive at school is worth the effort. I personally think it probably is not worth the effort for a number of reasons. But that's what we mean by COVID screening before going to school. Lisa, do you want to add to that? You're muted again.
Dr. Gerling, can I ask you one question? Sorry to interrupt you,
That's all
Lisa,
right.
but I introduced you and I did not say that you were with the public health department. So just for clarification purposes, you are not the health officer, but you served temporarily as the health officer. Can you clarify?
No, that's not correct.
Okay,
No,
one moment. Let me finish my question, please. Would you please clarify what your role is within the Alameda County Public Health Department? Because a lot of the questions that are coming in, I think, are based on the assumption that you have the authority to answer this question. So if you're not a public health employee, it might cause some confusion. So if you could just clarify that, that would be helpful.
Okay, so I am a general pediatrician, board certified, and I work for the Alameda County Public Health Department as the medical director for the California Children's Services Program. Many of you will be aware that that program serves children with physical disabilities and chronic diseases. So that's my normal role. Now, as a disaster service worker and an employee of the Alameda County Public Health Department, I was deployed to the COVID-19 response to serve as a lead physician in information and guidance. So essentially developing information and guidance for lots of different sectors, but my role is mostly for clinicians, for doctors and nurses and other people that are providing service in the community. So I am not the public health officer. I do have experience in that role when I worked as a deputy public health officer for Santa Clara County for about 10 years, but I'm not in that role in Alameda County. That's Dr. Nicholas Moss, who is the public health officer. So he's the one that actually has the authority to make policy decisions. I don't have that authority.
And if I may just add a little clarity for our listeners, our participants, Lisa Erickson and Dr. Louis Gerling are the two folks whom we work most closely with in schools. And on every call that Dr. Nicholas Moss may be on, Lisa and Louis are also on. So we are in close touch and close conversation when it comes to the issue of schools and implementing safety measures for students, teachers, that sort of thing.
Okay.
I do apologize. I'm going to have to sorry, Michelle, just I want to apologize that I have to drop off the call, but I have another obligation and I'm going to have to go. Was there something else before I drop
No,
off?
thank you for your time very much.
Thank
We
you, Dr.
appreciate it.
Garland.
And I know Lisa and Neetu, well, Lisa and Neetu pick up the baton here, but I'm going to be working from the comments we've already moved over into the document. And so again, I'm trying to sort of cover a wide range of topics here. We have about 15 minutes left on Town Hall tonight and quite a lot of questions. So I will be working through them to try and capture a variety of topics. So we have a question about the COVID liaisons from Dr. Damuamo, and it's, will COVID liaisons be solely focused on managing the guidelines, or will they be doing a full-time job in addition to being a COVID liaison? Who wants to take that one?
Michelle, you want me to take it?
Sure.
I think it depends a little bit on the district versus the school and how, if it's a large district, I would assume that COVID liaison will probably be doing mostly COVID liaison activities because it will be a pretty big job. That might look a little different if the school is smaller. But there are quite a few responsibilities of that COVID liaison. So it's hard to say if it should be full-time, but it's definitely probably looking close to full-time, I would say.
Okay. Question from Chastity Garcia. What type of contact tracing program will the county implement, if any?
Yeah, that's a good question. So that's what we've been working on. We actually went over that last week in our COVID liaison training. What we did is we tried to kind of talk about what the role of the public health department will be in contact tracing, and then what the role of the schools will be in contact tracing. Basically, the public health department will be responsible for doing all of the, actual contact tracing. So calling the contacts, the close contacts, and giving them all the instructions that they need and asking all the questions. But what we're asking from schools is that they would help us with giving us line lists. So just within the school context, giving us a list of all those close contacts and also giving them some quarantine instructions, as well as sharing resources with them, kind of in that maybe 2 to 3 day window, where sometimes it might take take a minute for the public health department to be contacting those close contacts. So it's kind of a partnership between schools and the public health department.
I'm going to go on. I'm going to go on to a question from one of our Facebook Live comments. Most of our school buildings are old and don't have proper ventilation to open schools. Further, we have lots of portables that have AC and are often required our union to contact OSHA. How can we open schools without proper ventilation? And then it says, now that we know that droplets can travel as far as 27 feet, why do we think it's okay to have students spaced 6 feet or less? So ventilation and spacing, I think, would be those questions that we want to take next.
Okay. So what we've done is we've given guidance for ventilation, and we've said it's a pretty extensive document that we've developed, and it's part of the guidance that Michelle showed you all at the beginning. We're not able to go out and sort of say for each school what's considered, good ventilation, bad ventilation. So it's going to be up to the school to kind of use that guidance and determine where they can make improvements and how they can try to, reach that guidance to the best of their ability. But yeah, there's many different areas, many different ways that you can improve the ventilation. Some is opening windows, having doors open. Some is improving your HVAC system. So it's a complex topic. And we don't really say in our guidance that you have to have, this particular practice in place, otherwise you can't open. It's kind of it's a comprehensive list of all different kinds of things that we're looking for ventilation.
Okay. All right. So a question about why aren't we having schools open a few grade levels at a time to make sure that school opening plans work? Lisa, you want to try this one?
Sure.
Not
I mean,
try.
that's
Yeah.
one of the reasons why we started with elementary schools, was to kind of phase it in. And I do think that actually in reading some of the plans, a lot of schools are just starting with some of the younger grades first, just to see how it goes. But yeah, that's definitely one reason why we didn't want to do all schools all at once, that we wanted to have a phased approach, was for that very reason.
All right. Let me see as I'm moving through. All right, this one is regarding special education students with special needs. What recommendations are you making to mitigate risk for those of us that work with students with special needs, whose students cannot wear a mask, cannot independently socially distance, and don't have the self-help skills to practice proper hygiene independently? Will you be recommending small cohorts? What specific recommendations are you making to mitigate these higher risk factors?
Yeah, that's a really good question. And what we say in our guidance is that if kids are not able to physically distance and wear their masks, then cohorting becomes even more important. So for an example, like all summer long, we've had early care and education programs open. And, those children, 4-year-olds, they're not able to physically distance. So the cohorts are very stable. They have the same staff, same kids all the time. So I think if you have a group of kids with special needs, that you're going to want to consider cohorts, it's even more important to have that small cohort that's stable.
Okay. All right, I'm going to do a bit of a time check at 6:22. We'll take a few more questions and then I'll go back to Trustee Knowles to finish, to see if she has any specific questions, and to just let people know how they'll be able to find a recording of this meeting and things, but we're going to take a couple of more questions. All right, this is about temperature checks. How is checking temperatures at school not worth the effort? We have seen parents in other states send their kids to school with COVID. We know parents in our community send their kids to school while sick. How are we supposed to trust an honor system on temperature checks?
I guess a question for me again. Yeah. So there's a lot of different aspects that go into the health screening. There's symptom checks, there's temperature checks, and there's a visual check. So I think there's a reason why there's all three, is to try to kind of capture what sometimes might be missed at home. It's not a perfect, way to do it, but I think the way all this guidance works is that if you have lots of different kind of mitigation efforts, all of it together, hopefully provides more safety. But just one thing, like just temperature checks, isn't going to be your end all be all for making sure that, that everyone is safe in the school. Also, temperature checks can be, from what I've heard, and again, I'm not a doctor, but what I've heard the doctors say is that it can be kind of like a false security sometimes, because you can have COVID without a temperature or a fever. So it's important to have other, things that you ask and check for.
I'm going to return to a question about testing for Superintendent Monroe. What will be the cost of testing to districts?
So the contract that we've signed is of no cost to districts. What this particular firm does is bill insurance for the cost of testing staff at schools. What we will be doing immediately following this, in fact, we're doing it now, is really looking at what it will take to test students, staff. It's a lot easier to obtain insurance information and figure out how to do that. With students, that is not so easy. So working with a lot of our partners to quickly then get a student option as students begin to return.
Okay. All right. Let's go to, let's see. All right, I'm going back to figure out. So there is a request for us to do this more often. Parents are confused and this town hall did not get a large portion of questions in. Still hoping for more guidance from our leaders. Where can parents go to see what guidance you are giving Alameda County school districts? So I'll take that one and just reiterate that there is a school reopening page on our county website at acoe.org, and the guidance document is prominently there, and it is available in Spanish and English, and is available both in a PDF and a web-based version. So it is very available for you all to go look and see what the mitigation measures and the guidance that's being provided to our schools and our districts. Let's see. Will Alameda County, okay, here's one. Will Alameda County Public Health and the Alameda County Office of Education commit to track and report cases at school and districts publicly?
Let you answer that one, Lisa.
Yeah, so we aren't able to, we will be tracking, you know, cases internally, but we aren't able to track cases. We wouldn't be able to say that this particular school has this many cases publicly. We aren't able to do that. It's because of privacy and HIPAA.
Sure. And
yeah.
then I can
need to feel free to jump in. Yeah, please.
So the Alameda County Public Health Department is what's called a covered entity under HIPAA. And so what that means is we're limited in what we can publicly share when it comes to cases at specific work sites, for example. So not just school sites, but all workplace settings. Specific workplace settings, we're not able to share specific case numbers. But we are exploring ways that we could share cases kind of related to kind of broader term workplace settings. So as you know, that data becomes more stable and we're able to kind of put those processes into place, we would want to do that. But in terms of actual individual school sites or school districts, we wouldn't be able to issue that information publicly.
All right, I'm going to kick this back over to Trustee Knowles, or President Knowles, to ask any questions that she might have and then wrap us up since we are at 6:27.
Thank you, Ms. McDonald. The question I think that is one of the questions that I have is if we will be continuing this sort of town hall meeting check-in process. And it certainly is my hope that we will, and I know it's a lot of work. But we are, I think, in a place where there's so much information out there, it's confusing, and sometimes hearing from an actual person addressing what's happening, where we are with school reopenings is very helpful. And so I know Superintendent Monroe, this is something that we have spoken about, and maybe inviting different speakers from public health to talk about wellness, testing, and a couple of other topics. So would you be able to speak to?
Sure. Yeah, we have definitely taken on having these calls for different stakeholder groups. Of course, it started with schools to try to support in making sense of just everything that was coming their way. And, you know, from private schools to public schools to districts, really committing to that. And then board members as well, understanding that board members needed a particular touch point. There is the broader public, which has been harder to figure out how to do, as evidenced by some of the challenges we're having this evening. So we have some rethinking to do about how to best do this. I think speakers are a good idea. I think webinars are also a good idea on particular topics. We can tell from these questions where the interest is, and we can really look at then, okay, people want to know more about this body of information, and look at putting out webinars or inviting speakers who can speak to that directly. I think going forward would be something that would be useful, and maybe even one webinar walking through the guidance, showing people how to get through the guidance, though it's updated every week. Just, how do you access it? How do you best use it? So certainly willing and wanting to do that going forward. I understand that this is a very complex situation.
I also, before we end this evening, want to acknowledge the students who logged in. I know that there are some students from Burke Academy and some of our Opportunity Academy students that are logged in tonight. And I know that there are a lot of questions from students. And so perhaps if one of those meetings could be focused on answering questions from students throughout the county, that would be great as well.
I think so. Yeah.
Thank you. Well, we made it. We made it
We did.
to our very first town hall meeting. Thank you. Thank you to Public Health, to Dr. Gerling and Ms. Erickson. Thank you to the ACOE communications team and IT team. Every Zoom meeting is an adventure, and I really appreciate everyone for logging in and joining us this evening. And this meeting will be recorded and placed on acoe.org, and you can also find any questions or frequently asked questions list and information about school reopening at acoe.org. Thank you again for participating. Thank you to everyone behind the scenes that helped make this a possibility, and we look forward to seeing you at the next meeting. Until then, have a good evening.
Thank you. Good night.
Thank you.